Hi, everyone. My name is Natassia Montagna. I am a dental hygienist in Parkland, Florida. I am also an orofacial myofunctional therapist. Today, I want to share with you a little bit about myofunctional therapy. What is myofunctional therapy? What do I actually do? So, I get this question a lot. I decided to make a video. So, myofunctional therapy is all related to four goals. So one is nasal breathing. We want the patient to breathe through their nose daytime and nighttime. Second goal is tongue resting posture. We want the tongue to rest on the roof of the mouth and not on the floor of the mouth. A third goal is the swallowing pattern. We want the patient to have a correct swallowing pattern. And the fourth goal is lip seal. We want the lips to be sealed during breathing, nasal breathing, and obviously nighttime nasal breathing, lips need to be sealed. So all the exercises are revolved around those four goals. So my job is to determine what is going on with that patient. Does that patient have a breathing problem? What's going on with their tongue? Do they have a tongue tie? Do they have a tongue thrust? A tongue tie is a restriction in the mobility of the tongue. And a tongue thrust is usually due to a breathing problem, sometimes also due to a tongue tie. Sometimes it can be all together, all encompassing. So the person has a tongue tie and the tongue thrust, which leads to a breathing problem. So the exercises in myofunctional therapy are basically like if you could envision a physical therapist giving you exercises to strengthen a set of muscles on your back or a set of muscles on your neck or on your leg, on your knee. Myofunctional therapy will do the same, except that I am focusing on the muscles of the orofacial complex. So I am going to share a screen here where I have a little presentation and I'm going to talk a little bit about myself. I am a dental professional. I have over 10 years of experience in the dental field. I started as a dental assistant and I went back into school to be a dental hygienist. Once I graduated from dental hygiene, I was really always interested in the holistic dentistry and whole body dentistry and how it relates to how the teeth relate to your whole body. So I started taking continuing education courses and I came across myofunctional therapy, which I got really interested in, and I started practicing it. So what am I looking for? Okay. So the tongue thrust is a small piece of a big puzzle. So the tongue thrust is the most recognizable orofacial myofunctional disorder, um, but it's just the tip of the iceberg. The bigger picture, the bigger puzzle, or the puzzle as a whole, is the airway. That's the huge focus. Another huge focus is facial growth. So facial growth has everything to do with how we're breathing. So the goals of myofunctional therapy in adults are less dramatic than in children. And that is because in adults, we are already grown, we are already developed. So we are a little bit more limited to how we can do things. But we can certainly help these patients manage their pain of TMJ, facial pain, headaches, head and neck tension. We can certainly help these patients with sleep apnea or sleep disorder breathing, help strengthen their muscles of the tongue and the lips and help them breathe better at night. And also we have to look into why are these patients in braces the second or third time, usually because the tongue is not in the right place. In children, it is we have a little more advantage. We can work with them. We can expand their palate so they have more tongue space. We can prevent problems in the future. Our myofunctional therapy is a great treatment as a foundation for braces. Is a great post-surgery for frenectomies, for jaw surgery, and also the habit elimination. So the thumb sucking elimination, finger sucking, or nail biting, we can eliminate that with myofunctional therapy. So why do they have a tongue thrust? Usually it starts with an infantile swallowing pattern that was never outgrown. So every baby grows with an infantile swallowing pattern, and which is a tongue thrust, and they never grow out of it. And usually that can come from feeding issues, colics or tongue tie, bottle feeding, pacifiers, sippy cups, etc. So the second cause is thumb sucking. Thumb sucking is huge because it's impairing them from putting the tongue on the right spot. It's making their oral structures grow in the wrong pattern. So they will usually grow with an open anterior bite, and the tongue is going to slip right through it. They have no tongue space. Their palate grows arched and high, narrow. And the third cause, sorry, my slide is frozen here. The third cause is airway and breathing problems. So all the ENT issues, enlarged tonsils and adenoids, chronic nasal congestion, sinus problems, allergies, anything that's going to cause the nose to be congested and not being able to breathe through the nose. That's going to cause mouth breathing, and it's going to cause a myofunctional disorder. The cause number 4 is a tongue tie. That picture is a grade 4 tongue tie. And I always like to bring this up that not every tongue tie is going to look like this. There's different grades of tongue tie. And sometimes we have what we call a posterior tongue tie, or we could also call a submucosal tongue tie, where what's tied is the genioglottal muscle, which is the muscle underneath the tongue, and not so much the frenum, which is the little piece of skin that connects the tongue to the floor of the mouth. So why does that matter? It matters because people with myofunctional disorders, they will have speech therapy, they'll have speech issues, so they have to go into speech therapy. They will have orthodontic issues. Their teeth are going to grow in crooked. They're going to be mouth breathing. They'll have a forward-facing posture. They'll have health issues, periodontal issues, dental issues, TMJ issues. Their facial features will be different. Okay, this is the perfect example of a myofunctional disorder patient. This is a class 2 malocclusion, where the lower jaw is more backwards, and they have that open mouth posture. They'll have a forward facing posture. They're mouth breathers. They have little droopy eyes. They'll have sleep issues. This is another myofunctional disorder patient, which is less recognized as a myofunctional disorder, but it definitely is caused by a low tongue posture, which is the class 3 malocclusion, where the lower jaw is actually more forward than the upper jaw. Okay, I talked about this. The most noticed facial characteristics are the long face, flatter features, sleepy eyes, droopy eyes. The dimpled chin when the mouth is closed. So at rest, their chin is all dimpled because this muscle right here is called the mentalis muscle, is working really hard to keep the lips sealed. And it will have a high vaulted palate. Okay, so these are the clinical signs, like I said, narrow, high vaulted palate. The expansion will be necessary for these patients. They'll have an open bite. That could be also, it doesn't need to be only on the front, it can be on the sides as well. The open bite can be a lateral or bilateral open bite where the tongue is thrusting through the sides. The sucking habit is a huge clinical sign of a myofunctional disorder. The tonsils, here are some tonsil grades, grade 1, 2, 3, and 4. These patients most likely will have a physical blockage, and that's the reason why they can't breathe through their nose. And I usually assess that in my initial consultations. I'll ask the patients to close their lips and breathe through their nose for 3 minutes. If they can do that, no problem, no struggles, then they're good to go with myofunctional therapy. If they're struggling to breathe and they need to open their mouth, or you can see the nostrils are flaring and they're really struggling, then they need to go to ENT consultation before they start myofunctional therapy. TMJ pain. So that patient with TMJ pain, you can see their masseter muscles are super overworked. They have, muscular pain. They are on night guards or they need night guards. We see that wear on the occlusal surfaces of the teeth. And the sleep disorder, breathing patients, sleep apnea patients. Obviously, we know if they don't have the tongue in the right position, their tongue is going backwards. There's nowhere to go, and it's blocking the airway, and they stop breathing through the night, or they're snoring. These patients are, usually struggling. They're going to wake up with their mouth dry. And they will have the droopy eyes. They don't get good sleep. Kids, they will be diagnosed with ADHD, ADD, because they're not getting good sleep. The forward-facing posture, that's a huge clinical sign as well, because they're trying to open up their airway. So they just move their face forward and the jaw gets out of the way to open up the airway. So they'll have a slouching posture. So that's it for today. And I hope this helps understand a little bit more about myofunctional therapy. And I hope to share more information in the future with you. Thank you. Bye-bye.